What is that?
Heroin.
It cost a lowly $3. It's staying high. Since the age of 14, he's been in and out of prison 29 times.
The war on drugs has not worked in Malaysia and has created many negative medical and social impact.
Come to about 2.8 million a day. Time 365, that is a hell of a lot of money.
Instead of putting them away for 2 years, only to find out, and of course, it doesn't cure them of their addiction.
Penanging drug addicts statistic in recent years keep rising. The problem of drug addiction is classified as a chronic, relapsing disorder characterized by compulsive drug seeking and use despite adverse consequences. Treatment and rehabilitation are a process of helping addicts to stop searching, compulsive drug use and subsequently abandoning drug addiction habits. From the architecture aspect, I would like to propose drug addiction treatment, rehabilitation and training hub to solve the problem in architecturally way. To start with the site I choose is suburb with a plain area, surroundings with social integration area and full of natural vegetation. The reason why I choose this site is because the site is sitting strategically where from site context analysis shows the easy accessibility, whole site exposed sun all day long. Site surrounding most is residential and partially is commercial where the community could bring the comfortable, cheerful and connected neighborhood. While patients' impressions may expect that they would feel more connected to the neighborhood, sense of belonging to the township, the existence of humans as biological beings and, at the same time, all of their activities necessary for their existence, as well as pleasant activities that they pursue in their leisure time. Humans are social beings and need socializing and communication for their existence, and this is exactly what drug addicts need to counter on. To start with the design, the concept of therapeutic architecture is applied by creating sensory healing environment, safety and security, sense of communal living and patient as a centered. While the behind of the design idea is that the nature is said to reduce stress and improve clinical outcome, which is to incorporate the farming activities as part of building program for drug addiction. To do that, the building is designed in horizontal way instead of scattered surround site. The idea of the main building structure will set at the north edges is the concern of the visibility to the building, the safety delivered to the society, buffer for the noise pollution and air pollution, and prevent the direct access to the building with provide farming vegetation to give patients feel more relaxation and calm. While the farming integration also can provide job opportunity for the patient and as a one of the relapse prevention system introduced in this design proposal. The overall design looks will deliver the by downsize the aesthetic value of the form, but to enhance the harmonized feeling and interconnection look with community context.
I say I'm the drug addict. I come here, I really want to find some money. Heroin, amphetamine, K, and then the pill, ecstasy. Also, I do everything drugs there because I want to give up like this in my life. So make my decision that I really want to change. That time I also already, my withdrawal coming. I also need to tahan because this is a chance for me.
So we took him in, put him through withdrawal.
I go through the program 1 year. Sometimes a lot challenge until people take the knife want to chop me. Now I already serving in the community Excel service, got 3 years plus. So I want to be a better man. I want to move on and I also want to show a good example for the others. Because if I can change, what for you all cannot change?
To open the door, I have to continually challenge David and take him aside and pray with him and say this is where you need to give back to society and make yourself more strong. You know, when you help others, obviously you will learn. I hope and pray whatever he learned from here, that he will apply in his life and in his future, and people whom he contact with